In the advent of social media, people are able to see themselves both from different angles as well as with different lighting. And I think that has caused people to really see themselves in a light that they hadn't before. I've even had patients come into my office with an unflattering photo of themselves and ask how they can address their submental fullness or their double chin, because it's really something that makes them feel self-conscious.
In 2015, Americans spent $13.5 billion on surgical and non-surgical aesthetic procedures. And this was an 11% increase over the year before. And this demand is continuing to rise. Every year, more and more people are taking advantage of non-invasive procedures to look the way they want to look. I'm seeing more coming in complaining about a double chin, but we call it submental fullness. It's the same thing.
Possible causes are genetics, weight gain, and aging. Now, my patients sometimes tell me they have parents or grandparents that had the same double chin, and they notice that this submental fat is increasing underneath their chin. So for them, it's a very frustrating problem.
We have completely non-surgical ways to treat this, where previously, and patients didn't even know this before, previously we only had surgery or a liposuction procedure to kind of treat this. We have completely non-surgical ways to destroy the fat underneath the chin.
Kybella is the first and only FDA-approved injectable treatment for adults to improve the appearance of moderate to severe fat beneath the chin by physically destroying fat cells in the treatment area.
Submental fullness due to fat beneath the chin can impact broadly in both men and women. I started using Kybella in my practice because many of my patients were unhappy, self-conscious, embarrassed, or bothered by an extra fullness under their chin.
A lot of my patients want to know how long Kybella lasts. Kybella permanently destroys fat cells under the chin in the treatment area. Once the desired results are achieved, within up to 6 treatments, retreatment is not expected.
If your double chin is bothering you, talk with your doctor and visit mykybella.com to learn more.
Patients should not receive Kybella if they have an infection in the treatment area. Kybella can cause serious side effects, including nerve injury in the jaw, which can cause an uneven smile or facial muscle weakness, trouble swallowing, injection site problems including bruising, hair loss, open sores, ulcers, damage and tissue cell death, necrosis, around the injection site. Call your healthcare provider if you develop open sores or drainage from the treatment area. The most common side effects of Kybella include swelling, pain, numbness, redness, and areas of hardness in the treatment area. Important safety information. What is Kybella? Kybella is a prescription medicine used in adults to improve the appearance and profile of moderate to severe fat below the chin, submental fat, also called double chin. It is not known if Kybella is safe and effective for the treatment of fat outside of the submental area or in children under 18 years of age. Who should not receive Kybella? Do not receive Kybella if you have an infection in the treatment area. Before receiving Kybella, tell your healthcare provider about all of your medical conditions, including if you have had or plan to have surgery on your face, neck, or chin, have had cosmetic treatments on your face, neck, or chin, have had or have medical conditions in or near the neck area, have had or have trouble swallowing, have bleeding problems, are pregnant or plan to become pregnant. It is not known if Kybella will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Kybella passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take a medicine that prevents the clotting of your blood, antiplatelet or anticoagulant medicine. What are the possible side effects of Kybella? Kybella can cause serious side effects, including nerve injury in the jaw, which can cause an uneven smile or facial muscle weakness, trouble swallowing, injection site problems, including bruising, hair loss, open sores, ulcers, damage and tissue cell death, necrosis, around the injection site. Call your healthcare provider if you develop open sores or drainage from the treatment area. The most common side effects of Kybella include swelling, pain, numbness, redness, and areas of hardness in the treatment area. These are not all of the possible side effects of Kybella. Call your doctor for medical advice about side effects. Please see accompanying full prescribing information or ask your healthcare provider or visit mykybella.com.